You are watching the DocTalk show.
Welcome back. We are discussing family planning. We have just appreciated some of the benefits that family planning brings along with it, including preventing unwanted pregnancies, preventing teenage pregnancies, and problems that are associated, health problems associated with pregnancy. Today we are discussing long-term methods, and with me are experts in the field of family planning to help us understand more about what these long-term methods of family planning are. So I will start with Dr. Dennis Chemonges. Implants are a type of long-term family planning methods. They provide protection over a long period of time. Help us understand what implants are. How exactly do they work?
Okay, so implants, they contain hormones which help to modify your body to prevent pregnancy. The brain is like the commander which sends signals to the body organs on what to do. So how the brain does that, it uses messengers which in this case we shall call hormones. Okay. So the implant is inserted into a woman's body, and then they release that messenger which helps to change, or which helps to deliver the brain's instructions to the organs. So they block what we call ovulation. Ovulation is the release of the mature egg.
And that's because of the effect of the hormones, as you've said, because in other words, it's mimicking a signal from the brain instructing the ovaries not to produce any egg. Okay, so just exactly how you said it's inserted in a woman's body. Which part of the body is it inserted?
It is inserted under the skin.
Under the skin.
Under the skin. In our situation in Uganda, we usually insert it under the arm, usually the less dominant hand.
The less dominant hand.
The less dominant arm. And within less than 5 minutes, the procedure is done. The procedure is done. Yes.
Are these implants very effective? People may not trust them that much.
Okay. In an HIV setting, if someone is on antiretroviral drugs, commonly efavirenz, one of the drugs that the HIV people take, can reduce the effectiveness of this. Okay. So, and among others, say like TB, anti-TB drugs, rifampicin, can also affect the effectiveness of this. But otherwise, in a normal setting, these are very effective, and they will last between 3 to 5 years of protection. So a woman will be able to have the protection for that period of time.
Okay, so in the ideal setting, every woman will be protected. It's just in a few scenarios where there will be some problems with some other medications.
Exactly.
Okay, and I think in those scenarios, the family planning method should be prescribed carefully.
Exactly. So it's a normal routine that before we give a particular type of family planning, we screen for their eligibility. The hormone or the drug that is contained in this capsule that is inserted under the woman's arm, it's a slow release drug. So we usually advise them to at least have dual protection, or at least use another method like condoms, say for example, or abstain for at least 1 week to have.
A very important point you've mentioned. Some people forget, they say when they put the implant it will offer immediate protection, but there's that delay as the hormone levels build in the blood to achieve the level of protection. Okay, so Dr. Dennis, it seems to be a very good method, these implants. Are there special advantages it has?
Saves time for the woman. She can have it inserted, and provided she has no problems, she can have it inserted and do her usual daily activities without an interruption, and rest for the time that she likes to. It's not a must that you have to use it the time that is up to expiry. you can use a 3-year implant for 1 year and have it removed. Anytime the woman would like to discontinue, it can be removed.
And does the fertility come back, the ability to have a baby again, does it come back immediately?
So the return to fertility, generally speaking, most women will immediately return to fertility within the first month. They should be able to return to their normal body functioning. However, we know that with implants and other hormonal methods like the injectable, some women may have a delayed return to fertility of up to between 3 months to 6 months. But generally speaking, these methods are reversible. It means that the drug, when it's finished from the circulation, from the body, the woman's body functioning returns.
In some women, they may change their cycle, okay? So they may change their bleeding pattern in a way that it may make them fail to see their period, okay, for some time, or it may increase the number of days they are bleeding, okay, or they may have a very light and irregular kind of period, okay, or some of them may just be normal, okay. So it is something that it varies from one woman to the other, okay, just like any other drug.
So it can change the lady's cycle.
Yes,
okay, but it doesn't mean it's not working.
Yes,
no.
yes.
And many women fear that if they are not bleeding, if they are not seeing their menstrual flow, they may think that they have got pregnant. But that's what they should understand, is that one of the ways in which the drug works is it may block the process of menstruation, but it doesn't affect your body functioning, or it doesn't affect your fertility. Yeah.
Okay, thank you for helping us understand more about these implants.
Yes.
Let us discuss now about what they call the devices, the intrauterine devices.
Yes.
They seem to be different from the implants. Both of them are available for women.
Yes.
But how do they differ? Dr.
Okay, so
Abdallah?
the intrauterine devices, just like the word goes, these are a long-term method of type of family planning, which involves insertion of this device into the woman's uterus, okay? Yes, the womb, the child-bearing component. And there are two types, the one which has copper, which doesn't have any other drug, and one which has a drug. And commonly we have the one with one we call the copper T, okay, which is inserted into the woman's uterus. And the advantage with this is it doesn't have the hormone like we discussed before. So this one is non-hormonal in nature.
This you mean the copper?
Yeah, the copper yes,
type.
the copper type, yes.
It doesn't have a hormone.
It doesn't have a hormone.
The second one has a hormone.
The second one has a hormone,
okay.
Yes.
So the copper one, if it doesn't have a hormone, what does it mean?
Yeah, so it just creates a hostile environment to hold the pregnancy or for fertilization and sort of, okay.
And also the metal, the copper, destroys the sperm and prevents them from reaching the egg. Okay.
So the hormonal type has a coating of a hormone, which helps.
It has a what? A coating.
A coating. It's coated with the hormone, which helps to make the wall of the womb unfavorable for pregnancy.
Actually, this one with the hormone makes the mucus on the cervix, the cervical mucus, very thick, that will deter the penetration of the sperm to head where it is supposed to meet the.
So the cervix is the mouth of the uterus.
Yes.
And you're saying there's like the entrance of the uterus.
Yes.
And you say there's this mucus. There's like a mucus.
Yes. The mucus, it acts more like a barrier, okay, like you said. Okay.
It acts a barrier. So that is the hormonal.
Yes, that is the
hormonal device.
Yes.
Will make that mucus thick
Yes.
and prevent sperm from entering into the uterus. So maybe we shall come back and discuss more about the advantages and disadvantages of these IUDs after this commercial break. Always send your feedback, questions, or comments to our social media platforms and enjoy the DocTalk show.
You are watching the DocTalk show.